Welcome to Friday Focus, May 13th, 2016. We're going to talk today more about a process that we were trying to put in place and something that will help benefit our patients and help our practice grow. So let's talk about a subject, skin cancer. Skin cancer is very common. In fact, the number of cases of skin cancer a year exceed the number of cases of all other cancer combined in North America. So it's very common. People that live to 65, so people that live to 65, that's most of us hopefully, 40 to 50% of them will get at least one skin cancer. So let's do the math in our office. Today, on Tuesday we saw about 420 people. Let's say of the 420 people on a Tuesday to the offices, let's say half of them are over 40. That means 100 of them will get skin cancer. And ask yourself, if you were in that situation, would you like to pick up the skin cancer early or late? There's some studies done looking at how important is the dermatology evaluation for skin cancer. And it turns out people can detect their own cancers, but they typically do once it's grown substantially in size, so it's spread more, it's more likely to be problematic. For example, for melanoma, which is the most serious form of skin cancer, when people pick them up, they tend to be much thicker than when a dermatologist picks them up. Okay, so people have like other cancers, the dermatologist who's a specialist in skin cancer will pick them up sooner than anybody else. So then they'll have more of a minor condition. So let's ask ourselves, if we have 400 people in a day, 200 of them are over 40, between 40 and say 70, then 100 of them are going to get skin cancer in the next 20 years. The American Academy of Family Practice and American Cancer Society recommend people between 20 and 40 get a skin exam every 3 years. And then over 40, every year. Now, there's not any clear and standard guidelines about who should do the skin cancer exam, how often it should be done. We know it should be done. We know that cancers picked up earlier have less disfigurement, or less, in the case of melanoma, less chance of dying from it. But mostly it's less disfigurement. And should we be keeping that information from our patients? I had a really troubling situation occurred where a patient that comes here regularly, done a breast lift and a tummy tuck and liposuction. She's had thermage, she's had Allure, she's had hair transplantation, she's had PRP, she's had multiple different procedures done. She's had cool sculpting done. She comes in all the time, and she asked me about a facelift. I pull her hair back, and there's sitting a basal cell cancer. I'm like, why didn't you get that checked? She goes, I didn't think anything serious. Well, she got a big hole in her skin, and had to be repaired and everything. But really, if we had done a skin exam in the last 5 years she's been coming here and had her set up to see the dermatologist, it would have been picked up smaller. We probably would have treated just with a little tiny removal of a lesion. But we had it here. We're holding out on our patients. And I want you to realize that a lot of these things that we do in our office that we offer, our patients don't know it. They don't know that they have a dermatologist here that can see them. We have 2 dermatologists at 3 locations now, potentially a 4th. We've got 3 dermatology PAs, so that we have the ability to check them. Now, we have this sheet, and this is like version 1, and always, improve, and it says, I've been offered a skin cancer screening with Allure Dermatology today. Really, skin cancer screening is just a full body skin check. And obviously we're looking for cancer, but also they can deal with other skin concerns they have. If they have like, dandruff or something like that. So I want you to give this to your patients, and yes, I would like to have a skin check today if we can do it. If we can't, we can schedule them for it, or no, have them decline it. Have them sign it, put it in the record. And that way, we can make sure that our patients know clearly that we can do skin exams. We can do it here. Their insurance, we're taking their insurance, something else, their insurance will cover it. And that really it's their responsibility once we've given them the information. Like, you maybe at a certain age you should get a mammogram every couple of years, but your doctor's not going to force you to do it, but at least he's going to tell you. We should tell them, we got a dermatologist. Skin cancer is very common. We can catch them at an earlier stage. We don't want you to have disfiguring lesions when they do get removed because you waited too long. If they get checked every year, if they do get skin cancer, which half people will, we'll pick it up at an earlier stage. So let's stop holding out on our patients and offer everybody a skin exam. And really, the number of patients we have going through our office, this is a huge service we can offer to them to reduce the chance that somebody's going to have to get a big skin lesion removed. Some people might check their skin regularly. They might already have a relationship with the dermatologist. That's okay. So already has a relationship with the dermatologist. We're all set. Some person might be a little too young. That's fine. But we should focus on people over 40 for sure. 20 to 40, give them the option. Say it's like every 3 years they should be checked, and then we'll give a good service to our patients. We'll keep our dermatologists busy, and we'll even be able to select out patients that we like, because most people in our practice we obviously like versus bringing people in from the outside. So that's the Friday Focus. Thank you very much, and good luck.